Hoflund syndrome. This is dysfunction of the vagus nerve, and the cause is injury from pressure or inflammation or injury of the vagus nerve. It can be from traumatic reticuloperitonitis or reticular abscesses or left liver lobe abscesses, which put compression on the reticulum. So for the pathogenesis, vagus lesions cause a decrease in vagus function, which causes a decrease in motility, rumination, and belching. This causes a functional stenosis and leads to blocked feed passage. It can happen cranially, which causes functional stenosis in the reticulo-omasal orifice. This leads to a decreased pumping and sucking function of the omasum, as well as a decrease of the reticular groove reflex and a decrease of rumen function, which causes fluid and gas to increase, which increases the size of the rumen. So when you look at the cow from the left side, you'll see a left flank enlargement. On the caudal aspect, it can cause functional stenosis of the pylorus. This leads to abomasum impaction, which increases the size of the omasum and the abomasum, and this leads to reflux and further ruminal enlargement. So as a result, we can see right flank enlargement and left flank enlargement, but the left flank is higher up due to the rumen and the right flank is lower down. For the signs, it can be subacute, but it's mostly chronic, and they can have weakness and irreversible weight loss. Their temperature can decrease and they can have pale and dry mucous membranes and exchazosis. In regards to the ruminal content, in the cranial side it's creamy and in the caudal side it's doughy. Animals can have long-lasting rumen distension. They have less feces and they're dry, pasty, sticky, and dark coloured. The typical shape of a rumen is L-shaped. However, in Hoflund syndrome, they can have a pear or apple-shaped rumen. Diagnosis, look at the signs. Is there chronic abdominal distension? Is there chronic weight loss? When doing a rumenotomy, is there abnormal ruminal content? For the treatment, you need to do surgery. If there's reticular abscess or a liver abscess, or artificial nutrition, or a permanent rumen fistula, usually you have to slaughter them. It's an irreversible condition. There's a very bad prognosis.